Hi everyone, my name is Dr. Adam Van Wert and I'm an Associate Professor of Toxicology and Pharmacology. I've been a professor for 12 years in a PharmD program, and I also have been teaching a toxicology elective for most of the time as well. And normally I post a lot of my long lectures for my courses on my channel, but I wanted to just post something kind of more intended for the public, and there's going to be a little bit of science involved, but I think you'll get the general idea of this whole black licorice toxicity. So there was a recent report of a man who died actually from eating too much black licorice every day. It's not something that we really hear about very often, but it did bring back memories to pharmacy school that I actually had heard of black licorice causing an increase in blood pressure or drug-food interaction. So I knew that it existed, but it's not something that's widely discussed. So I wanted to talk about the actual mechanism and what are the problems with black licorice. So is it toxic? And again, the answer is it really depends on the dose. Some of you may be familiar with the toxicologist Paracelsus from centuries ago, who said that anything can be toxic, and that's paraphrasing, but anything can be toxic at the right dose. Okay, so water can be toxic, obviously salt can be toxic, anything can be toxic. So yeah, black licorice can be, but the interesting thing about it is we know what it targets. Okay, and it's a very well-known receptor in the kidney that we're going to be talking about that black licorice appears to target. So what is the main culprit? So first of all, if you look at the bottom left, black licorice has something called glyceric acid. Okay, this is not going to be present in every single black licorice or every licorice flavored candy, but ones that are actually authentic or from like real extract from licorice will have this substance here, this glyceric acid. And you might notice, if anyone is in the chemistry field or something related to that, that this is actually a sugar group here, actually two sugar molecules attached to this structure here, which is very, very similar to our natural steroids. So again, this substance from black licorice has a sweet part, and literally you can taste the sweetness in licorice extract even without adding extra sugar to it, because of this group. And it's all here a single chemical, but we have two very different components. And again, this side it resembles things like estrogen, testosterone, cortisol, and things like that. What we know now is that glyceric acid can be broken down and release the sugar group, be broken down into enoxolone. And I wanted to give credit to Omar et al. In the references at the bottom there, who warned about the risks of black licorice in the 2012 article, Licorice Abuse, Time to Send a Warning. Okay, so they were very kind of prudent, and it was very helpful for them to bring that out into the literature, into the public basically, again in 2012. But for the most part, I have to say, being in the toxicology realm and teaching that, it's not something that comes up a lot, to be honest with you, until recently because of this death that we saw. So enoxolone in the blood can eventually get converted into something called a glucuronide conjugate, and that means another chemical will be binding to this, generally like the OH group right here, and it would look actually, believe it or not, similar to the starting substance, which is the glyceric acid. So it's going to attach a sugar group onto that, basically, and that's going to be what's causing the toxicity. So what actually happens here is that enoxolone, right, when it gets metabolized into the glucuronide, it inhibits something in the kidney called 11-beta hydroxysteroid dehydrogenase. So actually, as soon as I saw this structure, because I really hadn't recalled exactly how black licorice was toxic, but I saw this chemical structure and I said, man, that looks just like steroids. So it turns out that that actually is directly related to its toxicity, and that's because it blocks this enzyme in the kidney that normally converts cortisol, which is your natural steroid, natural glucocorticoid. It converts that to cortisone. Now, cortisol is naturally in your bloodstream, but the kidney has a mechanism inherent to convert it to cortisone, and what that does is it suppresses or reduces the activity that we're really trying to avoid that cortisol would produce in the kidney. And I'm going to explain that on on the next slide exactly what cortisol does. But the whole point is when this enzyme is blocked, you get an increase in cortisol in the kidney, and of course a decrease in production of cortisone. But this is going to have the toxicity that we're going to talk about. Okay, and it's mostly cardiovascular issues. So what are the actual issues that we get, and what is the mechanism? So excess cortisol in the kidney binds to something that's actually called the mineralocorticoid receptor. Okay, the mineralocorticoid receptor is something that normally binds to something called aldosterone. Aldosterone is a natural steroid-like substance. It actually is a steroid, and it's known to cause sodium in fluid retention. So again, cortisol is going to function just like our natural aldosterone, right? And again, this is our natural cortisol. That's going to bind to this receptor in the collecting tubules of the kidney. And you may not be familiar with renal anatomy, but each kidney has about 1 million tubules called nephrons. And at the very end of them, the portion there is called the collecting tubule, and that's where you can alter the reabsorption of sodium into the blood. So what happens is when this excess cortisol that builds up from the black licorice effect, when the excess cortisol upregulates sodium channels in the kidney cells, particularly in the side that's the side of those cells that is facing the urine, it draws that sodium out of the urine and places it into the blood. Okay, so that raises blood pressure. Now, that's, of course, not something that's desirable, but probably what's more toxic is the fact that every time sodium is reabsorbed in the collecting tubule, it is, in a sense, it's exchanged for potassium, and that's lost in the urine. So every time you reabsorb more sodium, you lose more potassium, and potassium it's got a very narrow window in terms of the concentration that's going to be safe in the body. So if you go too low or too high, it's very toxic. So in this case, we get low potassium or hypokalemia, and that can cause lethal cardiac arrhythmias, right? So it's going to really interfere with your heart rhythm. Okay, and that's really the main toxicity from black licorice. So the summary there is that black licorice is broken down or metabolized very easily into a substance that raises our natural cortisol, and that natural cortisol is going to cause sodium retention and potassium loss, right? And those are the main issues. So what I wanted to do here is ask a question for anyone that's really interested in this or in this field at least, to basically try to guess what medications might produce the same effect and therefore might be a higher risk in someone consuming excess black licorice. Okay, I didn't want to answer that here because I wanted it to be more of a discussion in the comments, so please answer in the comments. If you're subscribed, I appreciate it. If not, please consider it. And I'll probably be posting a few more of these shorter lectures in the future. Again, thanks for watching, and I'm really excited to see your response to that question.